Hi folks, Dr. Derrick Eddy, Akron Children's Hospital, Sports Medicine and University of Akron team physician. I'm here today with Caitlin to talk about how to train like a zip. Today we're going to talk about how to warm up properly and what to do if you do have an injury. So with warm up, what we really like to do is what's called a functional or a dynamic warm up. So what you see Caitlin doing is we're starting to get the heart rate up, starting to move, getting the muscles primed and ready, doing some right here, some high knees to get the muscle, the joints, the bones ready for competition. So no longer do we really do these static stretches and just hold it. We are actually priming, moving the muscles with like these butt kicks to really get the athlete ready. Here you see we're now doing some lunges, getting the knees warmed up, doing a little rotation, getting the trunk and shoulders loosened up. And now going backwards, again hitting all the muscle groups, lower and upper body. Now we're finishing up with some karaoke, or grapevine some people call it. Again, open up the hips, getting them ready. So unfortunately, one of the common injuries that we see in like women's basketball is an ACL injury. That's very, very common. So if I have an athlete that is, I suspect an ACL injury, the way I look at the athlete is first you get the leg in a straight position and I'm feeling for fluid inside the knee, right around the kneecap, which means that there was actually fluid in the joint and most likely blood in the joint. So first I check for the fluid, and then I check for the ligament stability of the knee, and there are 4 major ligaments. So the first ligament is the ACL that I look for, so I gently rotate the knee to the side, and then I just pull on the shin bone forward, which is what the ACL's job is, to prevent the shin bone from coming forward. And so I check the integrity of that ACL. And with Caitlin here, nice tight ACL, so that's normal. Then we have the collateral ligaments on the sides here, what's the MCL, the medial collateral ligament. And so we test it when it's straight, and then we put some bend in it and test it and make sure that it feels rock solid. So again, we hope that dynamic warm-up will help prevent injuries. With the ACL in particular, there are actually some proven ACL prevention programs out there that have become very popular because, again, this is such a common problem. And then after the competition, it's always good to do like a cool down. Again, what typically we do is, again, more of a functional cool down with some bands, or using a foam roller to roll out the soft tissue. If you don't have the bands or a foam roller to do after a competition, one of the things you could do is just a simple light jog or even a walk, just to get the heart rate to come down. And then if you're going to do any static stretching, this would be the time to do it after a competition.